Hi everyone. Um, so basically, um, you may be wondering why I haven't made a video in a very long time, or not, which that's cool too. But basically, wow, there's so much I wish I could just touch on because there's so much that's happened since I haven't made a video. But basically, I've been on lockdown and you know, barely leaving the house because I've had so much work to do. So basically, it's been like go to class, come home, sleep, do more work. Yeah. Anyways, you get the drift. So basically, I've had like no life for a very long time. Um, that's obviously my fault, and mostly the problem of just I clearly have a problem with time management. All I can say is, um, it's a lot of work that I have. I've said this before, and that I'm a political science major or whatever, honor specialization in political science, and I'm also minoring in history. So it's all essay courses and a lot of writing and research, and you know, um, I could have maybe organized my time better and I wouldn't be in the position that I was in, but, I don't know. I don't know, I could always organize my time better, but it's also just a lot of work. And I think I've talked about that enough. But, so lots happened. I was gonna talk about, the whole Canadian politics and proroguing Parliament and all that. I'm not going to right now. Um, to be honest, because in addition to being in my seclusive little bubble, I really have bringing. I go and look at news every now and then, but I'm not going to deny the fact that if I was looking at news, it was mostly CNN.com, and if I was, not doing work or whatever, and CNN doesn't really give great coverage on Canadian politics, so I do plan on kind of catching up on what's been going on in the Canadian political realm, but what's more important, and not more important necessarily, but what's more in the news right now, or what's just happened, is healthcare reform in the States. Yeah, so I'm very happy about it. It's not going to affect me necessarily. Being that, I live in Canada and have Canadian healthcare, which is really not bad. I don't know. Americans seem to be afraid of, God forbid, healthcare covers everyone. I don't know. I don't get it because they say it's socialism. It's not. I'm not gonna go into the definition of socialism and what our healthcare is like. You can look that up yourself, or if you want to comment. Either way, but and then anyways, onto the actual healthcare. So I was happy about it. Would I have liked to see a public option for the American people? Do I think that they would benefit from that? Absolutely. I think if you're American, I think you would benefit from it. In general, I think most people would. But of course, I don't know. I feel like I'm watching American news, or I'm watching or reading about it, and they seem so terrified of a public option. So terrified that government's going to control everything. You're not going to be able to choose your doctor, and you're going to be waiting a month to go for your checkup. I can say personally from my experience in Canada, are there wait times for certain procedures? Maybe, I don't know. From my experience in the people experiences of people in my family who've had to go through surgeries and things like that. For the most part, I mean, there's not really that long of a wait. I've never had to wait for anything. I mean, the times that something has been wrong with me, I was able to get care, within reason right away. If there's an emergency, obviously you're not going to be, left there to die. I'm not saying, like, obviously there are exceptions and everything, and people are going to go look up news stories and find the cases where, something bad happened. So no healthcare system's perfect. Canada's healthcare system is not perfect. There's a lot of ways that it can be improved, including the wait time thing, but I do find, it is a comfort to know that I don't have to think about going to the doctors. I don't have to think about the possibility that I'm going to be thousands of dollars in debt, or, is my healthcare going to cover me? Things like that. I mean, it's something that, if you grew up with it, you kind of take it for granted in the sense that I never really thought about it until this whole, the healthcare thing in the States. But anyways, I'm not bragging, by the way. But, yeah, anyways, so the public option is not in this healthcare bill, as we all know. But it does extend coverage to millions of Americans. And so I've been reading a lot of posts and things like that, what people have been saying, and there's a lot of criticism. Taxes are going to be raised. Doctors are going to get paid less. All these different things. And all I can say is, this is the first time, I don't know in how long, but I know in a very long time, that there's been a massive overhaul of healthcare. It's not going to be perfect. I don't understand why people are going to sit there and complain and complain and complain as if this bill is supposed to be perfect and answer every single thing, and nothing is wrong with it. It really is, in a sense, because it's never been done before in the States and been, quote in this way. It is very much, it's an experiment in a sense, and I'd like to think it's an educated experiment in the sense that, they thought a lot about it and have organized in a way that it should hopefully go according to the plan. As far as the tax increase, from what I've seen, and someone can correct me, but, the tax cuts that Bush gave to the rich, are apparently going to be taken away, and so, if anything, I mean, from what I know, the tax increase is going to be on the rich, who had the tax cuts. I don't know if I have a problem with that, and even if, if, let's say, I guess I find that the difference between Canada and the U.S., and, if you have a different opinion, but this is my opinion from everything, and I'm taking American history, and, I've taken American politics and things like that, and it's a recurring issue. There's a very different, like, Canada and U.S. are so similar, but at the same time, I feel like America is more founded on this whole individualistic, pick yourself up with your own bootstraps kind of mentality, and Canada, I feel, is a lot more, I don't know, it's not like that in that sense. Like, I'm listening, I'll be looking at a comment, and they're like, well, my taxes are gonna go up, and why should I have to pay for this random person to get health care, and, I don't, like, it's not my problem, or, now, it's just the way they're thinking about it, and then the way I kind of would think about it is more, okay, so taxes are going to go up, but other people are going to be helped from this, programs cost money, and if I can help, if, everyone has to kind of chip in a bit more, if that means that everyone's covered, I mean, I don't mind, I don't see the problem with, having to make a sacrifice, in a sense, within reason, obviously, reasonable limits. I'm not saying, should be tax zeros, but I mean, I don't find anything necessarily wrong with how things are here in Canada in terms of, I mean, we have higher taxes in the States, but we also have universal health care. I don't know, so I'm not trying to judge or anything like that. I don't want that to be the impression I give, but, so, yeah. I haven't really talked much about the actual bill, have I? But I'm sorry, this is going to be done now. But thank you for watching, and comment, debate, contribute, tell me off, or enlighten me. Thank you. and